So, have you had a previous cesarean section? Are you unsure how you want to deliver your next baby? In this episode, we talk about the good and bad of trying labor after a cesarean section, and we help you make the decision of what you want to do. We will cover the benefits of trying for a vaginal delivery after a cesarean section, which commonly is referred to as a TOLAC, and the risks associated with it for both mom and baby.
So if you like this topic and want to hear about other topics that are similar to this, please hit the subscribe button below. We'll be coming out with new content every Wednesday morning. We cover everything from pregnancy, labor, delivery, postpartum, breastfeeding, and newborn care. Make sure to read our disclaimers below and sign up for our community at www.shefoundhealth.ca. Also, check us out at Instagram at she.found.health. So, whether to have a TOLAC to try for a Vbac, a trial of labor after cesarean, to try for a vaginal birth after cesarean, is a really important conversation to have with your care provider. We have this conversation all the time with our patients, and it's very much an individual conversation. It depends on your family situation, it depends on what your hopes and dreams are, and it depends on what actually happened in your previous delivery that led to a cesarean section. So we're going to go over the generalities of it, but we really think it's important to have an individual discussion with your care provider.
So, why try for a Vbac, vaginal birth after cesarean? Well, everyone has different reasons for wanting to try for a successful Vbac, and these are sort of the most common ones. They're planning on having multiple pregnancies, so it's easier to have multiple vaginal deliveries than it is to have multiple cesarean sections. They really want to have a vaginal delivery, or they're just generally trying to avoid having another surgery. So let's talk a little bit about each of these more.
So women who are planning on having multiple pregnancies, let's say 3 or more, should probably try to have a vaginal delivery after cesarean section if their first baby was a cesarean section, especially if that was for a breech position or it wasn't because the baby didn't fit out of their pelvis. Every time we have a surgery, we have increased risk. There's increased scarring there and increased risk of kind of the negative outcomes of surgery happening. And so if we're able to have a successful vaginal delivery after a cesarean section, then that means subsequent deliveries will most likely be vaginal as well, which tends to be over the long term lower risk. Now, if you're going to have 1 or 2 babies, it's not a big deal. Having a second cesarean section is relatively low risk in the grand scheme of things. So certainly having 2 babies is not a reason to try for a Vbac unless you really want to try for vaginal delivery.
So, wanting to try for a vaginal delivery, some women have a desire for vaginal delivery and others do not. This is very individual, and there's not necessarily any rhyme or reason to either one of these desires. Or sometimes there are very good reasons. So what we do as care providers is we have that discussion and support the women in their choices. We want to make sure they're well informed of the risks and benefits of each choice, and we want to help support their wishes in a safe environment. We're all different, and so are our thoughts and feelings around modes of delivery, and that's the most important piece, is to be supported in whatever you choose is best and safest for your family.
And again, this is your family and your decision, so nobody else gets to have a say in it, and you don't have to worry what other people are going to think about it either. So another reason that some people try to have a vaginal birth after cesarean is to avoid another surgery. Now, as we said before, there's always risks associated with a surgery, and some people that's riskier than others. So for some people who have a blood clotting disorder, for example, having a surgery gives a bigger chance of them getting a blood clot. So they may want to try to avoid that. The other reason some women want to try to avoid a cesarean section is the recovery time is a little bit longer. So we're looking at about a 6-week window of not being able to lift anything heavier than your baby. So if you have a toddler at home that's very dependent on you, or your partner works quite a bit and you have to manage at home with the 2 kids, you may want to try to have a vaginal delivery just for ease of recovery. Now, from my experience, my recovery from my cesarean section was easier than my recovery from my vaginal delivery. But I did have a toddler at home and I had a husband to help me out, so that made a big difference. So don't necessarily think that a vaginal delivery is going to be easier than an elective cesarean section, but certainly that is something that people do take into consideration.
So what makes for a good TOLAC candidate? So that means what are factors that might, make us think that a woman would be successful in having a vaginal birth after cesarean? So when we know someone's going to be a good candidate, they can have up to a 75% chance of having a successful Vbac. So that's huge. The most important reason for being a good candidate is the reason why you had your cesarean section in the first place. So some reasons that would make a woman a good candidate and have a high likelihood of success is if she had her surgery for placenta previa. So the position of the placenta alone was the indication for the surgery. If the baby was in a breech position, so not head down, and that was the indication for the surgery, or if the surgery was done for, reasons related to the fetal heart rate, not how the normal labor was progressing. If the baby was in a bad position, so labor was progressing well, but baby was looking up instead of looking down or in another abnormal position, then that could increase your chance for success. Or if you had a really large baby in your first pregnancy, but this baby is actually looking like it's not going to be nearly as big. Another reason is if you actually go into labor on your own during your TOLAC, your likelihood of success is increased.
Now, there's also reasons that you would not necessarily be a great candidate for a trial of labor after cesarean section. So Sarah kind of alluded to one. So if your labor didn't progress normally, so if you had a very slow labor, despite your baby being in an optimal position and you weren't able to either get to fully dilated or push your baby out successfully, it probably means that there was a mismatch in size of baby and your ability to birth the baby through your pelvis. That would definitely be considered if this baby is approximately the same size as the previous baby. Another reason is if you've had previous surgery on your uterus. So surgery for fibroids or anything that they go through your uterus. It's actually really dangerous for you to labor. And the same thing would apply that if you've had 2 previous cesarean sections, we really wouldn't recommend that you try laboring in a subsequent pregnancy. There's a much higher risk of that scar, either from the fibroid surgery or from the previous cesarean sections, coming apart and having a uterine rupture. And this is when your uterus muscle comes apart and baby is actually expelled into your abdomen, which is not ideal and is an emergency.
Another type of surgery that would not be a candidate is if you were told you had a classical cesarean section. So a C-section is usually the incision on the outside looks like a bikini line incision, and the incision on the inside is the same. If you've had a classical cesarean section, which is typically done when your baby's born quite early, the incision goes up and down on your uterus, and that is an absolute contraindication to having a vaginal delivery.
I.e., please don't do it.
Yeah.
So a couple other reasons why you may not be the best candidate to try for a vaginal delivery would be if you have a very large baby this time. The larger they are, the harder they are to come out, and so the longer our labors are and the more stress it puts on that uterus. Also, if you are quite obese, if you're carrying a lot of extra weight, you're less likely to succeed in having a vaginal delivery. And if we need to do an emergency cesarean section, it's a much higher risk surgery than if you were of a normal body mass index or a normal weight. And then the last reason we wouldn't recommend having a trial of labor after cesarean section, or you'd be less likely to succeed if you actually went into labor after your due date. So we'd like to hear from you. Why do you think it would be a good idea to have a Vbac or a bad idea to have a Vbac? If you have an opinion on this, then just please link it in the comments below. We'd love to hear your thoughts on this.
So something we both feel that is really important for women to know is what are the risks associated with a trial of labor after cesarean. It's really important to be aware of any risks associated with decisions that we make, and mode of delivery is no different. So the most common risks are what Alicia already talked about, uterine rupture. That means the scar actually opens up and the baby gets expelled or passes out into the abdomen, which is not ideal because it really impacts the blood flow to the baby. Another risk is requiring an emergency cesarean section. So if you decide you don't want to have a TOLAC, you'll have a planned elective cesarean section, which means it's smooth, you go in, there's no rushing about. If you're trying to labor and it's not going successfully, then you go for another emergency cesarean section, which is often the reason you may have had your first cesarean section, and that can be scary for some women to go through that process again. There's an increased risk of infection or bleeding associated with trial of labor after cesarean section, and there can also be complications associated with the baby from a cesarean section.
So we went through a few of these, but we'll go through them in a little bit more detail now. So uterine rupture. So again, we've described that quite well, I think. So the risk of having that happen after one cesarean section is about 1 in 200 women. So about every 200 women who labor with a previous single scar on their uterus, about 1 of those will have a uterine rupture. Now, each time you have a cesarean section, or if you have more significant surgery on your uterus, that risk increases. And our job in obstetrics is to decrease risk to you and decrease risk to your baby, so both of you can come out healthy, and happy and safe. So once we get over about a 1 in 200 or 1 in 100 risk, it's really frightening for us as care providers, and should be for you as well, to put that risk on you and your baby. The other thing to remind us about is, because that risk is present, even if it doesn't sound very high, it's really important that we don't labor at home. If you are trying for a labor after cesarean section and you've had a good informed discussion with your care provider, that's wonderful. But we really need to be cautious and keep a very close eye on you and your baby. And so laboring at home is generally not advised. And we ask you to come into hospital earlier than you would otherwise, so we can have a good listen and make sure that you and your baby are safe throughout that process. The other reason we want you to be in hospital is if that rare but significant complication does occur, we can get you to the operating room within 10 minutes and hopefully save your baby's life. If you're at home and it takes you 20 or 30 minutes, even if you're brought in by ambulance, there's a good chance that your baby wouldn't survive that happening, which is why we take this small but significant risk very seriously.
We also talked about requiring an emergency cesarean section. So this is a known risk. And the reason why we mention it is that recovering from an emergency repeat cesarean section is more challenging than an elective or a cesarean section that you've taken by choice. So depending on your chance of having a successful VBAC, you may not deem it worth it. If you've got toddlers at home, if you've got other reasons that you're not really looking forward to another complicated or prolonged recovery, then a VBAC or a TOLAC might not be for you.
Also, an emergency cesarean section has slightly higher risk involved to it than an elective cesarean section. At an elective cesarean section, we can take our time, we can get through the scar tissue and all the layers very carefully, make sure there's no organs in the way, make sure we're not damaging anything we shouldn't be damaging. But if we're in a true emergency and we're trying to save you or your baby, we have to do things much more quickly. So there's a higher risk of having those complications that we know of with any surgery. So some of those complications that we know are associated with surgery are infection and bleeding. But actually those are higher with a VBAC as well, successful VBAC. So there's a higher risk that you are going to have a postpartum hemorrhage and that you're going to have a postpartum infection. Also, if you have an emergency surgery, that's also a higher risk for both of those things as well.
We also mentioned possible complications with baby. So this is probably the biggest question we get from women is, what about the baby? Which is the safest option? And while the risks are really low for both VBAC and elective repeat cesarean section, but probably slightly lower of having significant issues as a result of birth in the planned cesarean section, and slightly lower in terms of breathing issues that may require a longer stay for VBAC.
Mm-hmm. So if you have a successful VBAC, that's probably the safest for you and your baby, but we don't know that going in, and that's part of the problem. An elective planned cesarean section is safer than an emergency cesarean section. And so it's all about what your hopes and dreams are. And what I often say to women is, if you had to look back on this day or this decision 5 years from now, would you still make the same decision knowing what you know now? And for some women, a trial of labor is the decision that they would make again. For some, it's an elective cesarean section. And for others, we just wait and see. And you know what? There's no right or wrong answer, and you can change your mind throughout. So a lot of women that we counsel will actually choose to have a booked cesarean section at, say, 40 weeks. And if they go into labor before that, they'll try for a VBAC. But if they don't, then they have their elective cesarean section. And that's a totally fine plan as well, as long as you had that discussion and know the risks and benefits going into that.
That's often what I counsel my patients about as well. And another thing that we'll say is that you have a bit more control when you're doing a TOLAC in terms of when you want to pull the chute. So if things aren't progressing, we don't have to wait until it's a true emergency situation. You can have been trying, you've got prodromal labor, things aren't progressing as you thought they would. We can just plan and stop and have a cesarean section then. We don't have to wait until things, really get scary or the baby showing signs of distress. So there's a lot of control that you have in this setting.
Yeah. So there you have it. That is hopefully a good basis for a discussion with your care provider of what your choices are and what you might decide to do. We'll link to a couple of great resources below. One of them is called the Power to Push campaign out of BC Women's Hospital. Also, if you found this useful, don't forget to subscribe to our YouTube channel and check us out at www.shefoundhealth.ca. Have a great day.